Assalamu alaikum wa rahmatullahi wa barakatuh. Hello and welcome everyone. Thank you for joining us for today's webinar. My name is Alia Shawab, clinical dietitian and bariatric care specialist at ICLDC, Imperial College London Diabetes Center in Abu Dhabi. I'm going to be your host tonight. I'm going to be taking you through our webinar, and thank you again for joining us. The webinar is hosted and organized by the Emirates Clinical Nutrition Society. I'm the head of Scientific Committee Chairs member, and I will be giving you a brief about the society shortly. Just a few housekeeping rules before we get started. If you have any questions, feel free to write in or type in your questions in the question and answer box in your control panel down below. Live chat support will be available. If you have any problems, you can contact them on the WhatsApp number that you see on the screen as well. The webinar is recorded and will be available on demand and on the APCCN website. We'll be talking about the website shortly as well. And the webinar is of 1.5 CME points by MOHAP. And now, without further ado, I will give you a short introduction to our society so that we can start ahead. Okay. Okay. The Emirates Clinical Nutrition Society, under the Emirates Medical Association, it is a non-profit medical society established in 2016 under the auspices of the Emirates Medical Association by the efforts of a group of clinical nutritionists concerned in the management and evaluation of nutrition and diet and well-being of the communities in the United Arab Emirates. Although it has been established in 2016, each course is of a period of 3 years duration, consisting of 5 members. For this duration, the board of directors, as you see on the screen, is Ms. Afra bin Ketta, the president, Ms. Masouma Al-Jasmi, vice president, Ms. Raisa Al-Kitbi, general secretary, and myself, Alia Shawab, scientific committee chairperson, Ms. Muna Muhammad Al-Shammar, the head of the cultural society. The goal of our society is to serve.
Hi, doctor. Could you please put your slideshow, put your slide on slideshow and move the slides? Thank you.
Just 1 second. Is it okay? The society serves to conduct continuous professional development activities, enabling nutritionists to update their knowledge and provide a common platform to network, aiming to reinforce the lifestyle of communities in the United Arab Emirates in order to increase productivity and encourage communities to actively promote healthy living. Therefore, the Emirates Clinical Nutrition is the embodiment of prevention better than cure.
Dr. Alia, we
yes?
still can't see your slide. We can just see the holding slide. So could you please put it on slide full screen and start sharing your slide? As in, we can see your slides, but we cannot see you moving the slides.
Okay, so I think there's a problem with the screening. Just
you could probably stop this sharing and just start it again. Yeah, perfect.
Okay,
thank you.
It's fine. Okay. If we talk about the main focus of the society, improving the scientific output and performances of the members, providing an opportunity for nutritionists and dietitians to contribute to the movement of scientific congress, raising the level of performances in health specialties, contributing to improving the criteria and standards of practice within the profession and advanced levels of health awareness among the public. There had been a few events that have been conducted throughout the year, online webinars and workshops, as we can see. These are the few that have happened throughout the year. And looking forward to upcoming events, we have a few webinars leading to our 12th Virtual Asia Pacific Conference on Clinical Nutrition, APCCN, that I've talked to you about during the beginning, which will be held in December, hosted by the Emirates Clinical Nutrition Society and in collaboration with the Chinese Nutrition Society in China. You can have a look at the website that will be indicated at the end of the presentation, and you can register for the webinars as well as the conference. For membership registration, you can directly log on to the IMA website or send an email to the membership@ima.ae or directly contact one of our ECNS members for membership questions or queries. Moving forward to our presentation, as we mentioned, today's topic is about nutritional management of COVID-19 for chronic illness or chronically ill patients. I'll be talking mainly about the importance of nutritional intervention and how it has proved to be of great importance during the pandemic in preventing and reducing symptoms in patients with COVID-19 of those with underlying diseases or otherwise healthy patients. I'll be talking about the pandemic, why is nutrition an essential part of the treatment, the effects on patients, effects especially on the immune system, malnutrition, and the criteria for categorizing malnutrition, NCP or the nutrition care process, nutritional screening and assessment, and nutritional consideration for patients with pre-existing conditions. To start with, what is the novel coronavirus or the COVID-19? It is a novel, highly contagious infection caused by a severe acute respiratory syndrome, coronavirus 2 or the SARS-CoV-2, which has been or has become a global public health challenge in the last few months. Although the pathogenesis of the virus has not been clearly understood, there is evidence of a hyperinflammatory immune response in critically ill patients, which could lead to multi-organ failure and ARDS or acute respiratory distress syndrome, symptoms of which include respiratory symptoms, fever, cough, shortness of breath, trouble of breathing. And as we all know, the mode of transportation is through airborne, close personal contact, or touching an object infected with the virus. Since this pandemic has become a huge problem that tackles the health of and well-being of individuals, it is very important that to understand the challenge that has to be tackled and by addressing and minimizing the symptoms ahead rather than looking for the treatment, and thus preventing the occurrence or the prognosis of such side effects. Why is nutrition important, or why is nutrition essential? It is important for good health, to build immunity, protect from infection and support recovery, such as preventing illnesses and infection of immunocompromised patients, efforts to preserve and promote nutrition, proper nutrition, including breastfeeding and for infants, preventing strategies, all help and support and build resilience of individuals and communities. It is very important to consider nutrition as it is the key for boosting immunity and in preventing non-communicable diseases, and as well as undefined diseases such as with high risk factors, including or that could lead to morbidity and mortality rates increasing. Food and nutrition security must be safeguarded and secured to avoid food and malnutrition crises that can be seen in less developed countries, which that could be a huge problem and therefore causing causalities increasing. Nutrition, as we can say, as the most important part is that it cannot be delayed or cannot wait on short-term nutrition disruptions, which could cause irreversible effects on the survival, health, and developmental statuses of patients with higher risk factors. So it is very important to keep such patients under stable conditions. As we mentioned, the importance of nutrition on our bodies, especially the importance that it has a direct and indirect effect on health, mainly the immune system, which we will be talking greatly about during our presentation. Therefore, we can say that ensuring adequate nutrition is followed, which could lead to utmost health and prevention measures from remission or from attaining certain risk factors or prognosis and comorbidities. The effect of nutrition intervention on COVID-19 patients, is it important or not? However, like we mentioned, it is a key determinant of health, but is it a cure for COVID-19? Not necessarily. When following healthy eating patterns, we ensure that the patient's immune system is optimized, the immunometabolism is improved, especially when we have problems in muscle loss or weakenings, muscle atrophy, maintaining skeletal muscles and avoiding metabolic disturbances, preventing malnutrition, which is also, again, an important factor and trigger which could cause patients to be more susceptible to attaining the virus. It is a modifiable contributor to the development of chronic diseases, highly associated with COVID-19 deaths, as we can see in geriatric patients or older aged patients. And nutrition has a positive impact on COVID-19, especially, as you mentioned, older patients or those with pre-existing conditions or non-communicable diseases. On the immune system, diet and proper nutrition influences the immune system competence. It determines the risk and severity of infections and is directly related to infection and immunity. As you mentioned, it has a direct and indirect effect on the immune system, causing to renal or multi-organ failure, not only renal. Therefore, we can say that changes in one component could impact greatly other components or other parts of the health system. Micronutrients and phytonutrients in a diet are essential to promote healthy immune responses, and that would be discussed later on the treatment modes by my colleague. Malnourished individuals might have suboptimal immunity, contributing to challenging recovery when infected with COVID-19. As you mentioned, those most critical patients, example, those with an ICU that develop ARDS, are at high risk than others. Malnourishment is the nutrition imbalance that affects both over and underweight individuals. It is characterized by the presence of two or more of the following: insufficient energy intake, weight loss, loss of muscle mass, loss of subcutaneous fat, localized or generalized fluid accumulation, diminished functional status. Those patients may present with skin rashes, puffy feet, sunken cheek, loss of muscle mass, particularly in the upper arms, and they may functionally appear having difficulties in moving around, getting tired a lot, and have poor grip strength. That could be seen functionally in such patients with malnourishment. There is a criteria for malnourishment. Patients are categorized either with acute or chronic, mild, moderate, or severe malnourishment, and could be illness-related or not, as we can see. Malnutrition is a quality issue where if it could go undetected, could cause severe risk and nutrition risk. That can be due to the lack of consistent screening, lack of diagnosis, lack of treatment, lack of monitoring of nutritional status. Therefore, we can say poor quality of care could increase the risk of nutrition risk factors, increasing the susceptibility of infection and increase in mortality rates. Patients are assessed for nutrition risks, which allows early identification of malnutrition, which could go unrecognized or untreated, therefore preventing malnutrition complications. And the goal for such therapy is to support nutritional status, increase performance status, body composition, immunocompetency, and therefore promoting or improving quality of life. Like we mentioned, the NCP includes early nutritional screening, which could assess the patient has malnutrition or not, therefore going further for deep nutritional assessment to check what kind of deficiency the patient has, or what type of problem that the patient has, to be diagnosed, nutritionally intervened. And the most important part of the nutrition care process is the monitoring and evaluation, so that the patient can be monitored if he was in a hospital-based setting or not, on regular basis. As you mentioned, nutritional screening and assessment, there are several tools that have been developed to assess and screen patients that have been developed by the ESPN. I will go through them shortly. Nutritional screening identifies a patient who has nutrition risks, classifying the risks and preventing, therefore, further declines in nutritional risk status. It detects, like we mentioned, nutrition risk and referring the patients for further assessment to improve the clinical outcome. The main goal of such screening is to maintain or manage nutrition and prioritize the patients. Nutrition assessment measures dietary or nutrition-related indicators, identifying the patient's nutritional status, if the patient is well-nourished or malnourished, and is only done on those patients referred, therefore nutritionally at-risk patients, determining the severity of malnutrition. The difference between both tests: nutritional screening is simple and rapid, requires minimum measurements, it's less expensive, information is concise and simple, and it is done on all patients admitted. Several tools are there. I'll go through them shortly. Nutrition assessment is time-consuming, complex, more in-depth, requires more measurement, and it's more expensive and done for those, as we mentioned, nutritionally at-risk patients. Regarding the tools that have been used, for nutritional screening, there are three tools developed by the ESPN: nutrition risk screening, NRS, which is done for a hospital-based setting patients; malnutrition universal screening tool for most adults; mini nutritional assessment, MNA, for geriatric patients. Nutrition screening rules, or most of the screening tests used, they are check if the patient has risk factor, which is mild, moderate, or severe, depending on the score. Several questions are being asked: BMI, weight loss within the last 3 months, dietary intake, recent dietary intake, and the severity of illness of the patient. And depending on the score, patient is categorized, if it's more than 3 or less than 3. Malnutrition universal screening tool for the adults, as we mentioned, is more or less the same. Same questions are being asked, and the scoring range depends on how malnourished is the patient: low risk, medium risk, or high risk. This is the same questions. The mini nutritional assessment screening, again, addresses the same questions, but on a more depth patient. Since we're talking about geriatrics or elderly patients, it's done on 2-part questions addressing the same. And again, we have a screening or a total scoring points to assess the malnutrition status of the patients. And then when we move to the nutritional assessment tools, it is a subjective global assessment, physical examination, which is done mainly by the physician, or we assess nutrition-related physical examinations that could be of importance, such as skin color, rashes, deficiencies that could be visibly seen. Laboratory examinations, most of, again, as we mentioned, the prominent that are relevant to nutritional, such as deficiencies, iron, vitamin B12, albumin, which could be an indicator or for a risk factor, but not necessarily be a causal risk factor. Subjective global assessment, again, categorizes a few questions, and then we could see if the patient is malnourished, moderately well-nourished, moderately malnourished, or severely malnourished, based on weight, nutritional intake, symptoms, activities, or the function of the patient, and again, the physical examination relevant or not. This is a basic assessment, nutrition assessment used in a hospital-based setting that addresses, as we mentioned, the same criteria to assess the patient whether is nutritionally malnourished or not. Moving on, nutritional considerations for patients with pre-existing conditions during COVID-19. Majority of the severe symptoms and complications that could be seen resulting from COVID-19 infection are mainly reported among geriatrics or older adults or those with underlying comorbidities, as we can see that they are more prone to getting infected from these diseases, which would likely to take a more severe course in the reference to complications and then a prognosis which could be exacerbated to increase fatality rates. Therefore, it is very important to assess the risk of malnourishment or malnutrition, which leads to impaired immune system and exacerbate symptoms. It is important to increase awareness and attentiveness on such patients to prioritize the detection and the testing comprehensively, treating such patients. Nutritional management and intervention. There are a few guidelines that have been developed by the ESPEN and ESPEN to address such patients, and that will be by my colleague next. She's going to be talking about the intervention and management. In conclusion, I would like to say that it is very important and crucial to maintain nutritional status and nutritional and relevant nutritional therapy as a first-line treatment measurement to implement the standard of practice. As we have seen, based on clinical observations and researches that have been done throughout the past 3 months, worse prognosis that go with uncontrolled malnutrition in patients or those with underlying causes consist or cause a higher mortality rates, as we mentioned, in malnutrition, elderly people, those with lower immunity, or patients with chronic diseases. It is very important that we can say good nutrition would cause a stronger immune system. However, if nutrition care is integrated in the recovery programs, it can positively impact clinical outcomes as well as the quality life of such patients. Thank you very much. And we can move on to my colleague. One second. Okay, we can move on to my colleague, Masouma Al-Jasmi, who is going to be talking about the nutrition management of the chronically ill patients. Masouma Al-Jasmi is the head of nutrition section and senior clinical dietitian at Al Jalila Children's Hospital, UAE, and is the vice president of Emirates Clinical Nutrition Society. Welcome, Masouma, and thank you very much for joining us. Thank you, and you can start.
Thank you, Adia, for introduction. Good evening, everybody. My presentation, it is about the nutrition management of the critically ill patients during the COVID-19. And aim of this presentation, introduction guidelines for the all patients, symptoms of COVID-19 with the nutrition implications, nutrition management for mild and moderate symptoms, nutrition management for pulmonary disease, kidney failure, critically ill, feeding routes and formula choices, and finally, obesity and children with COVID-19. As Alia she's mentioned, the nutrition management treatment is very important to enhance immune response for infected individual. There is sufficient evidence to demonstrate that immune response can be weakened by inadequate nutrition. Therefore, the verification of the nutrition status of COVID-19 infected patient before, during, and after the administration of the general treatment, and providing appropriate nutrition intervention is important. The use of the therapeutic modified diet as the base for the nutrition management is encouraged. As we know, the COVID-19 present with the symptoms that require different type of the nutrition management. We will start with the symptom of the COVID-19 with the nutrition implications. The symptoms, it ranges between the mild, severe symptoms that needed the specialized management, like the uncomplicated illness, runny nose, fever, cough, headache, and sore throat, mild pneumonia, breathing difficulty, inflammation in the lungs, severe pneumonia, acute respiratory distress syndrome, kidney failure. According to the nutrition management for the mild symptoms, according to recommendations, we have to ensure to intake adequate fluid, at least 2 liters of the water per day or more if there is fever. The tables that show the fluid requirement from the different ages, started from first of the 10 days until 85 years. In case if the patient have the fever, we have to increase the calories intake by increase the amount of the nutrition food and increase the number of the time patient eats. The food should include a variety of the energy-rich foods, meat, milk, legumes, and pulses, fruit, and vegetables. In case the patient, we assess the patient and we found that the patient not gain weight or not get it enough from the diet, we have to consider vitamin and mineral supplementation. For example, protein for healing and the recovery, vitamin A for the skin and the tissues found in the eggs, spinach, carrots, broccoli, potatoes, vitamin C that stimulate formation of antibodies found in the citrus containing foods, bell pepper, papaya, strawberries, tomato juice, vitamin E, neutralized free radical, which is we found it in the fortified cereal, sunflower, seeds, almond, vegetables, and peanut butter. Zinc for wound healing found in the lean meat, poultry, seafood, milk, whole grain products, beans, seeds, and nuts. Other vitamins like the vitamin B6, folate, selenium, iron, as well as prebiotic and probiotics. What is the nutrition management for the mild syndromes? According to recommendation, coughs can be relieved by usage of the honey, pineapple, chicken soup, gargling, and hand washing. Sore throat can be relieved by taking the tea, honey, ginger, turmeric, and sea gel. Also, to improve the antioxidant level in our body, we can improve by herbals or increase consumption of the fruit and vegetables. Herbals like the oregano, sage, and cinnamon. Also, we have to limit intake of the refined carbohydrate like sugar, sweet cake, soft drinks, and sugar sweet beverage. Limit intake of the foods containing trans fat and saturated fat, like fatty skin from the meat, hydrogenated vegetable oil, fried foods, cookies, and pastries. What is the nutrition relevant sign and symptom in the pulmonary disease? It is the patient with the pulmonary disease, they have the early satiety, anorexia, dyspnea, weight loss, water retention, vomiting, anemia, abnormal production of the sputum, fatigue. And we will talk about each management, each symptoms management. For example, early satiety, we have to encourage the patient to eat small, frequent, nutrient-dense meals. For patient with the anorexia, we have to encourage them to eat the preferred nutrients, meals and snacks. They have to increase intake of the fruits, vitamin and mineral supplement maybe improve on the appetite and food intake. The patient who has, they lose weight, we have to encourage them, or we have to ensure adequate intake of the food from the all food groups. Adequate protein intake is key to prevent muscles wasting. For example, the protein we can give 1.2 to 1.7 grams per kg per day, energy 30 to 35 calories per kg per day. For dyspnea, we have to encourage the patient to eat diet with lower carbohydrate and healthy fat. Healthy fat, as we know, canola oil, sunflower, avocado, corn oil. To me, this kind of the oil, or most of the oil, to meet the energy requirement for the period when the breathing is difficult. Also, to eat the proteins from the good source, like the eggs and the lean meat, in addition to healthy diet. We have to provide adequate but not excessive nutrients. Sometimes we have to avoid the overeating, we have to give the 50% of the requirement intake, and later on, when the patient it will be better or stabilized, we can increase it gradually to reach the whole requirement. For fatigue, we have to include a source of the protein at the very meal to sustain energy release from the food, limit the sweet and the sugary food, avoid the alcohol and caffeine, eat small frequent meals through the day, exercise with the cautions while considering degree of the illness. Multiple micronutrients supplementation may be considered for the patient at risk of the vitamin and minerals deficiency or whose intake is inadequate. For abnormal production of the sputum, we have to increase intake of the fruit and vegetables, like including citrus fruit and leafy vegetables. Increase intake of the warm drinks, including the clear broth soup meaning the soup which is without the cream or dairy, and the warm decaffeinated tea. Also, we have to avoid any of those food like eggs, fish, milk, nuts, peanuts, shellfish, wheat, and soya if the allergic or any intolerance. Due to this kind of the food increase the mucus protection. Also, we have to avoid some food that naturally contain the histamine for the same reason, which is increase the cause of increase the mucus production, such as the processed meat like the hot dog, vinegar, dried fruits, avocado, tomatoes, spinach, mushroom, eggplant, cheese, yogurt, sour cream, and buttermilk, smoked fish and sardine, and alcoholic beverages. Okay. For anemia, as we know, the anemia, we have to increase intake of the iron-rich foods, including green leafy vegetables, meat, and vitamin C to enhance and to improve the absorption of the iron, such as citrus fruits. Consider supplementation dependent on the severity and the cause of anemia. For vomiting, we have to give the patient small frequent meals during the day. Consider intake of the dry foods and snacks. Do not, we have to encourage them to not take fluid with the meals. They have to take separately between the meals. Eat while set it at a degree between the 45 to 90 degrees and take some time before lying down again. Fluid retention. Some patients with the fluid retention require sodium and the fluid restriction. Dependent on the diuretic prescribed increasing, dietary intake of the potassium may be required. Due to the fluid restriction, use of the total parenteral or the high calorie enteral feeding may be help meet energy needs. Nutrition management for the kidney failure. The nutrition therapy in this case, in this patient, should be based on the severity of the multiple organ failure and not on the impairment of the renal function. Essential dietary modification include the energy, protein, potassium, sodium, phosphorus, and the fluid based on the disease stage. For the protein intake should be adjusted according to catabolic rate, renal function, and the dialysis losses. Patients with the renal failure who require nutrition support therapy should receive enteral nutrition if the intestinal function permits. Electrolyte intake in the patient should be adjusted by the monitoring serum concentration of the potassium, magnesium, and phosphorus and calcium. Regarding the energy and protein requirement for acute kidney injury, we have to give around, we have to increase the energy needs by up to 30%. For the enteral nutrition, provide 20 to 30 calories per kg, adaptive to individualized needs in case of underweight or obesity. For the parenteral nutrition, we have to provide 30 to 35 calories per kg per day, should be administered as carbohydrate and lipid solution, and the serum concentration of glucose and triglyceride control. Regarding the protein for acute kidney failure, for the patient on the continuous renal replacement therapy, 1.8 to 2.5 grams per kg body weight is recommended. For the patient on hemodialysis, provide 1.5 per kg per day and can be increased to 2.5 grams per kg per day based on need. For the chronic, the nutrition, the calories, protein requirement for chronic kidney disease, for the maintenance hemodialysis, we can give 1.2 grams per kg per day. Peritoneal dialysis, 1.3 grams per kg per day. Stage 3 and 4, we can give 0.3 grams up to 0.6 gram per kg per day. Regarding the fluid, balanced fluid and the electrolyte intake to output, sodium is restricted, dependent on the level of the urinary excretion. Normally, we give 2,400 milligram per day, which is 1 teaspoon, unless in situation of the hyponatremia, which we have to identify and we have to correct it. Potassium, individualized according to serum level. Phosphorus, a normal level is 2.5 to 4.5 milligram per deciliter, should be maintained. Phosphorus restriction is advised when the GFR is less than 29 milligram per minute and patient on dialysis. Okay, now nutrition management in critically ill patients. Nutrition treatment for critically ill patient is a key measure to reduce mortality. The energy, the nutrition treatment of children with the critical illness 28 days to 18 years old is basically similar to the adults, with a slight difference. It is shown here in the ESCO filled formula, can be used to determine the energy target amount. For example, for the first table, it is the energy requirement from 0 to 3. The second table, it is energy requirement for age 3 to 10. And the last one, energy requirement for 10 to 18 years. Regarding the protein, the target amount of protein, it is 1.5 gram per kg per day. For infant and young children, a higher amount of the protein may be required to achieve positive nitrogen balance. Short peptide formulations are the more common for the enteral nutrition preparation in the critical ill children. Energy requirement for adults, we have to determination of the nutrition target amount first and energy target quantity. To calculate the energy requirement, indirect calorimetry is currently recognized as the ideal method for measuring actual energy consumption to cross infection, so it is not applicable. Therefore, it is recommended that resting energy expenditure can be calculated from the volume of the CO2 value measured by the ventilator. Okay. The calculation formula is we can use it VCO2 multiplied by 8.19. If it can not be if it is not available or we cannot measure estimated energy requirement according to body weight, we can use it. For non-obese critically ill patients, the recommendation amount of the energy target it's 25 to 30 calories per kg per kg per day. For obese and the critical ill patients, if the BMI between the 30 to 50, the recommendation energy target is 11 to 14 calories per kg per day. If the BMI more than 50, the recommendation energy target is 22 to 25 calories per kg per day. In addition, we have to calculate it as dextrose, which is 3.4 calories per gram. Glycerol 4.3 calories per gram, and the lipid 1.1 calories per ml are the required to provide additional take energy into account. For the feed initiation, we have to start feeding at the low dose and reach the energy target amount within 3 to 7 days. For the patient with the hemodynamic instability, nutrition support should be started as soon as possible after fluid resuscitations is completed. In the initial stage of the stress, such as infection, feeding should be started at the low dose, and initial supply should not be exceeded more than 70% of the target amount. Can also try to tolerate low calories. We can give the 50% of the target feeding amount. After stabilization, the energy intake should be gradually increased to target amount within 3 to 7 days. For protein, target amount of the protein, improve the energy supply ratio of the protein from the 15% to 25% to 30. We can reach it to 30%. For the non-obesity critical ill patient, the recommended daily protein target amount is 1.2 to 2 grams per kg ideal body weight. For the obese critically ill patients, BMI 30 to 40 kg, 40, the target amount of protein it is 2 grams per kg, and if the BMI more than 40, the target amount of the protein is 2.5 grams per kg. Fat, in the total energy supply ratio of the recommended diet and the tube feeding, nutrition reaches 25% to 30% of the total energy. But in case for the patient with the COVID-19, who are the critical ill with the parenteral nutrition, due to changes in the fat absorption and the metabolism, excessive intravenous injection of the fat can lead to overload of the lipid and toxicity, leading to hypertriglycemia and the abnormal liver function. Daily venous fat is recommended to be 1 gram per kg, and the maximum is not to be more than 1.5 gram per kg. And the dose needed to be adjusted according to individual tolerance. Micronutrients, according to the recommended daily amount of the micronutrients for the total parenteral nutrition, it's mentioned in the table. I will not go in details. It is okay, but just we will talk about the some of them, like the vitamin C. Many studies have shown that high dose vitamin C, 3 to 10 grams per day, intravenous injection can be significantly reduce mortality in critical ill patients. For vitamin D deficiency is common in the critical ill patients and is associated with adverse clinical outcomes, including higher mortality and infection rates, longer hospital stay, and the longer mechanical ventilation. If the vitamin D level of the critical ill patient is lower than 12.5 or nanogram or per milliliter or 50 per nanomillimole, vitamin D3 should be supplemented. For phosphorus, hypophosphatemia often occurs in critical ill patients. Needed to be careful about it if the presence of the refeeding syndrome. Recommended to closely monitor the serum phosphate concentration and to give appropriate phosphate supplement if necessary. To remove this. Okay, the nutrition treatment option and approaches for the critically ill patients. There is 5 steps. We started with the diet, nutrition, and nutrition education. Then, if needed, we go to diet, oral nutrition supplement. Then we go to enteral nutrition, totally enteral nutrition, full food from the enteral nutrition. Then partial enteral nutrition plus the partial parenteral nutrition. Then, if not tolerated, we will go to total parenteral nutrition. When the nutrition support method in the next step cannot meet the target energy requirement of the 60% for 3 to 5 days, the nutrition support method in the previous step should be selected. Oral diet, a new COVID-19 critical patient who can eat on their own and have no risk of the vomiting or the aspiration. Oral diet should be given priority as soon as possible, and the goal is to meet 70% of the nutrition requirement within 3 to 7 days. If the oral diet does not meet, we can go to oral nutrition supplement, followed by the enteral nutrition according to the specific condition of the patient, general or disease specific, such as diabetes, renal disease, etc. For the patient with the dysphagia, first try to reduce the risk of aspiration by changing and other methods. If the dysphagia worse, we can go to enteral nutrition. The enteral nutrition indications. Enteral nutrition can maintain the integrity of the intestinal barrier, prevent gastrointestinal complication in patients with mechanical ventilation, promote intestinal immune function. Also, we have for some patient we have to start or we have to give the trophic or the nourishing feeds, which is defined as 10 to 10 milli of feeds per hour or 10 to 20 calories per hour, can prevent intestinal mucosal atrophy and maintain the intestinal integrity. Okay, about the enteral nutrition formulation choices, we have formula, diabetes formula, renal specific formula, high energy density formula, and high dietary fiber formula. Standard we give for normal patient, diabetes It is suitable for the patient with the diabetes or accompanied by the elevated blood sugar. Renal specific formula suitable for the patient with the renal insufficiency. High energy density formula we give for patient who's lose weight or needed for more calories. High dietary fiber suitable for the patient with the persistent diarrhea or the patient who has constipation. And for the standard formula, we can add 10 to 20 gram will be given in individual portion within 24 hours to increase fiber intake in the standard formula. Also, we have the short peptide formula. It is suitable for patients who suffer from the diarrhea due to gastrointestinal malabsorption. Pulmonary disease type formula. It is high fat, low carbohydrate, but whether the severe patient with the mechanical ventilation use the high fat, low carbohydrate formula is still controversial and needed more study to get it. Gastrointestinal complication of enteral nutrition, abdominal distension, and the vomiting. First, we have to use it gastrokinetic drugs. If not improve, polaric feeding should be adapted. For diarrhea, we have to go slow down in the infusion rate, dilute the enteral nutrition formula with water or reduce the osmotic pressure, switching to high dietary fiber formula or short peptide formula. Check the temperature of the nutrient solution. It is not recommended to stop enteral nutrition completely due to gastrointestinal intolerance. Parenteral nutrition indication, water and sodium retention and with the COVID-19 for patients with the high nutrition risk when the enteral nutrition cannot be reached 60% of the total intake, we have to go to the parenteral nutrition. Okay, now nutrition management for the obesity children and the COVID-19. Why are the children and the adolescents important? As we know, obesity in this age group is increasingly prevalent. Prediction of the obesity globally in 5 to 19 years old. In 2020, 158 million, expected to increase it to in 2025, 260 million, and in 2030, 254 million. For children and young people, the COVID-19 pandemic potentially makes obesity prevention more challenging, affected access and availability to treat for obesity. Okay. The impact of the COVID-19 in children. To what extent are the children with the obesity affected by the current pandemic? The children, they are less likely to develop fever, cough, and shortness of breath. 1 to 5% of the positive cases with the low mortality rate. 5 to 7% of the children are hospitalized. For the infant and those with the underlying condition, more likely to progress to severe disease. Okay, the consideration for the children health and obesity. How can overweight and obesity to be reduced? We have to encourage mothers to give for the baby 6 months exclusively breastfed. We have to encourage them to start weaning early time by the 6 months. After 6 months, I mean. We have to encourage children to eat fresh and unprocessed food. We have to make sure that children drinks enough water every day. Limit energy from the total fat and sugars and the salt. Healthy fat, as we mentioned before, like avocado, nuts, olive oil, soya, canola, sunflower, and corn flour, rather than the saturated fat found in the fatty meat, butter, coconut oil, cream, cheese, and ghee. We have to increase consumption of the fruit and vegetables as well as legumes, whole grains, and nuts. We have to encourage the children in regular physical activity, at least 60 minutes a day for children. We encourage the family to cook meals at home, which is improve the quality of the family diet. Food is healthier and the more nutrients for growing children than calories-filled food from outside. And also we have to encourage them, as we said, to be healthy and increase the physical activity. Always we advise them they have to eat healthy, be active, sit less, and sleep well. To maintain the healthy weight is important all stage of the life, whether in infancy, childhood, and teenager age, in order to maintain healthy weight and to be healthy children. Okay, how we can start it? We have to encourage for the breakfast to have the breakfast. Research shows that kids who eat the healthy breakfast are shown to have the better nutrition, healthier weight, and the better performance in school. Some advice that we advise for the parents, they have to plan the breakfast before the bed. Include they have to the breakfast is supposed to be include 3 food groups out of the 5 which is the grains, protein, fruit, vegetables, dairy. A healthy breakfast should be have high fiber, carbohydrate source, and the protein source. This is some example of the healthy breakfast. Drink healthy. We have to encourage them to avoid the unhealthy drinks, and we have to give for them the water tracker, which is help them to count how much they get it water per day. Proper portion size, sorry, this is by mistake. Proper portion size, as we know, the restaurant and the fast food, they give the super size, which is I think it is the first or the one of the reason of the unhealthy weight gain. Okay, for portion size, it is very important to be small and variety food, which is contain whole food group. Also, the recommendation or advice that we give for the parents, try to eat together as the family, prevent kids from the eating their meals in the front of the TV, keep it unhealthy snack out of the sight. If they select or they have the unhealthy snack, they have to section in small bags and to eat it during the day or during the 2 days or 3 days, not in one day, all the amount. Little bit we will talk about the telehealth. Telehealth is it's used. Telehealth is the use of the digital information and communication technologies such as computer, mobile device to access healthcare service remotely, manage the patient healthcare to improve or support healthcare service. Advantage and the disadvantage of the telehealth. Advantage, support the social distancing. Patient preferred consultation. But in terms of the new diagnosis, we prefer to meet the patient face-to-face. Family oriented, through the telehealth, we can educate so many people in the member of the family, like the parents, caregiver. The one advantage also, the patient, they are not miss the appointment. Disadvantage, technology, internet, or the discontinue of the internet, it's one of the disadvantage. It is difficult to some people, they prefer to come in the clinic because the education, it will be more effective. Noise and the distraction in the room environment, it is one of the disadvantage of the telehealth. During the telehealth, what we have to discuss, what we have to give, we can talk about the eating, planning mealtime, advantage of the meal preparation at home, identifying the healthy snacks, physical activity, stress reduction, education, like include the topics such as the healthy food choices, learning cooking. Also, we can educate them about the importance of the sleep on the time, or the time requirement for sleep. Thank you. This is my reference, and we are ready to get at any questions.
Thank you, Ms. Masuma, for the extensively informative presentation. Thank you very much. I think we can go ahead now and start reading your questions. Don't forget to write down the questions in the Q&A box in your control panel. Let's start. We have a few questions coming up from Dana. Can I have the reference of those recommendations, because I didn't find anything regarding mild symptoms, nutrition therapy? I think, Ms. Masuma, the recommendations, I think there are the references at the end.
Yeah, it is listed in the last pages.
Yeah, okay. Regarding to the energy requirement, if BMI is 30 to 50, the energy requirement is 11 to 14 kilocalories. And same if BMI is 50, then energy requirement is 22 to 25 kilocalories. Cannot get the point. I think there's a mix-up between the kilocalories recommendations. If you would like to go through that.
Can I go to my slide?
Yes, please.
Okay. Recommendation energy target in 11 to 14 calories per day. Okay. Yeah, maybe by mistake I put it up and down. Sorry for that.
Okay, so that was just a mix-up.
Yeah.
Okay. I usually have allergies from Johara and sneeze a lot every day. What shall I do with a diet to get better? So a diet for allergies, is that what she's asking?
What is her questions?
I sneeze a lot and have allergies.
Okay.
What diet do I do to get better? I think like
which kind of allergy? It is related to which kind of food that she's not tolerated, or she has allergy. Which she's supposed to know it, which kind of the food she has allergy.
Yeah, so most probably she has some allergy from something to eat, because the sneezing and allergies, unless she has the flu, that's a different case. Okay. How can a high fiber diet help with diarrhea, since the fiber will increase the bowel movement?
Yes, there is some studies that the fiber, it is help to control the diarrhea.
Okay.
But high fiber, it is be treated for the constipation and the diarrhea.
so it depends on the level of
Yes.
diarrhea that the patient has, and as well as any underlying causes or diseases. Okay, okay. So that was answered. Okay. What would you suggest for a pregnant woman to improve her immune system, especially in such during the pandemic? Because that's one of the most asked questions with pregnant women. What should I have? What should I take to improve my immunity?
Pregnant woman is a healthy, balanced diet, like the normal pregnant woman. It is the same. But in case the pregnant woman needed for the high protein, high calcium, this is the different issues. But for if we go to then the diet, it is normal diet for any pregnant woman, and we have to calculate it according to the weight, according to the stage of our trimester, which she's in which trimester, the first trimester or the second trimester of the pregnant. According to these issues, we have to calculate the energy requirement and distribute the healthy balanced diet for her.
Okay, okay, very well.
No, there is no specific diet related for the COVID-19 or the patient is infected with the COVID-19. It is just healthy diet for all patients. But in case we have any symptoms or associated or with other disease, we have to treat that disease. But for COVID-19, we don't have a specific diet. Just we treated the symptoms that related to the disease.
Okay, okay, okay. What could you say is the best recommendations, nutritional recommendations for children, since to improve their immunity, since we're starting school season? Most parents are very concerned. What could you suggest as healthy snack options, or what could they send with their children to school to improve their immunity?
Yeah, as we said in my presentation, the snacks or the meal is supposed to be contain three of total food groups, which is the grains, proteins, dairy product, and fruits. If the meals it's contain 3 to 4 of the food groups, we will get it the good immunity, and we will get it good nutrients.
How about from Famida, we would like to know about the role of vitamin D in the prevention of COVID-19. The role of vitamin D. If you have anything to say.
I don't have any idea. I don't know about any study that they said the role, the person that they have the vitamin D deficiency, they will get it, they infected more than others. Really, I don't know.
Yeah, there is no relevant studies so far that indicates any relationship of vitamin D so far. So the answer is there's nothing specific of that. Okay. Can a lactating mother who is diagnosed with COVID-19 continue breastfeeding her child? If you'd like to answer that as well. Yes, yes. It is safe for a lactating mother, although she is infected with the virus, as long as she takes protective measures, wears her mask, etc., and not handle the child for a very long time. That is what's being done with the lactating mothers. Okay. From Lali, is there anything special that can be taken for chemotherapy person or a person on chemotherapy?
Chemotherapy, they needed high protein, high energy, high calories.
Because we can
and according to the age, we calculated the protein amount and we will give it.
But they are enlisted as the immunocompromised patients.
Yes.
Requiring high protein. Okay. What are the few often talked about home remedies would you recommend to boost immunity? Yeah, we were coming to that question because there are a lot of fad and fact diets that have been going on regarding home remedies that can be taken for improving immunity and preventing COVID-19. What have you to say on that?
My advice to follow the healthy diet, balanced diet, enough water, sleep proper times, avoid any unhealthy diet, and you will be okay.
Yes, because we've heard a lot of taking certain herbs, taking certain vitamins, taking certain things to improve. But again, there is no study to prove it.
No study, no.
Yes, okay. Is it recommended to wash fresh produce with special detergents to make sure there is no virus contamination? From Iman. I don't think so. Washing food or vegetables or fruits with some kind of detergents to make sure there is no virus contamination. From my side, I don't think so. What do you think, Masuma? Okay. We have read and heard a lot about zinc role in COVID-19. What's your opinion about it? Zinc.
About what?
Zinc.
Zinc?
The role of zinc in COVID-19.
Zinc as the supplementation, or zinc from the real food? For real food, it is recommended, but for supplementation, there is no any recommendation.
As long
Just
as the person,
if we have the zinc deficiency, we can get
exactly.
the supplement, but just to prevent to not get it the COVID-19, there is no any.
As long as there is no deficiency, there is no need.
No need.
Yes. Okay. Okay. What is your go-to diet? If someone asks you, give me something like, what should I be taking right now? I need to boost my immunity. What would be my 5 top dietary items or supplementations that you want me to take? My go-to diet.
Which kind of diet?
Anything that boosts my immunity. Like some patients or some people would ask, what would I want to take if I wanted to take something, some kinds of vitamins, some kinds of herbs or anything? What
I said,
would you recommend?
Just follow the normal diet, balanced diet, contain all 5 groups. You will get it all the nutrients, vitamins, minerals that you needed.
Hydration. What have you to say on hydration or the water intake, especially with the hot weather? Some people have attributed diets of increasing your water intake will prevent virus contamination. What would you like to say about that? There are a lot of fads and...
I don't think, but no. As I mentioned, I explained in my presentation, we have to avoid dehydration by taking enough water. In case we have a patient have fever, we have to increase our intake of the fluid. But to drink water to avoid of COVID-19, really, I don't know. Really, I don't read it. I not during 2-3 days. Just I am read to get it the information. I don't get it any information related to dehydration or the water and COVID-19.
Okay.
Water, it is good for health, to be hydrated. During the summer, we needed enough water to drink, to avoid that constipation, to have the nice skin. This is all the benefit of the drink of water, to clean our body.
Okay, fair enough. Okay, I think we have covered most of our questions. Any more questions? Let me just double check. I think we've covered about everything. What would you like to say, Masuma, at the end?
Thank you for attend, and really I appreciate, because we are the end of this week and the afternoon. It is very hard to attend the presentation. Really, I appreciate your attending to my presentation.
Okay, just before we go, there is a question not relevant to the COVID, but about bariatric surgery. Patients after bariatric surgery, how can they drink water? I think I'll be answering that. Depending on the status of the bariatric surgery, as soon as the surgery is done, obviously the patient won't be able to drink only sips of water for like a few days, and then that would gradually increase. If the patient is unable to drink or tolerate water, they can go for ice cubes or try مثلا cold water or lukewarm water, depending, and then gradually increase the intake. Okay, so I think a few more questions have got in. Regarding 2-liter fluid intake, should it be water or other fluids like soups or green teas will be considered as well? Yes.
Supposed to be from fruits, soup, fresh juice, any kind of the food, fluid. Yeah.
Okay. So let me see. Protein recommendations for dialysis patients?
It is according to each stage.
Depending on the stage of the patients, yeah. Okay. Anything else? Since we still have time, we can take a few questions. Okay. Well, I think no
but
more.
Still, the hemodialysis earlier they needed more protein rather.
Again?
They needed more protein during the dialysis.
Protein recommendations for dialysis patients? Yes, more protein. Okay. Yeah. Okay, so I think we're done with the questions. Thank you very much, Ms. Masuma, for your time, for your beautiful presentation, for the information that you provided us today. And on behalf of the Emirates Clinical Nutrition Society, I would like to thank you all for joining us today. I hope you enjoyed our presentations. Like I mentioned earlier, all the material will be and the video will be available on demand and accessed on the APCCN website. Hope you found this valuable, and don't forget to register for the conference and to have a look at the upcoming webinars as well. It will be mentioned in the website. Have a great evening and good night.
غلط حاطة